And I'll resume with swearing in the witness. Okay. 1 second.
Thank you, Dr. Camphor. That's much better.
Let me repin her, please. Just a second.
Yep.
Okay. Dr. Camphor, would you raise your right hand? Do you solemnly swear or affirm the testimony you're going to give in these proceedings will be the truth, the whole truth, and nothing but the truth, so help you God?
I do.
Hold on just a second, okay?
What are we doing now?
We're having trouble with the view on the computer. We're making it so we can see everyone because all she could see was herself.
It went to speaker view as opposed to gallery view, Jim. Now it's ready.
Thank you, Paul.
Thank you.
State and spell your full name, please.
Sonia Camphor, S-O-N-I-A, Camphor, C-A-M-P-H-O-R.
And did you use that mobile phone number in the care and treatment of your patient, Billy Saunier, in November of 2018?
No, I didn't.
Have you reviewed any documents in preparation for your deposition here today?
Yes, with my lawyer.
What documents have you reviewed?
The ones that were presented to me at the time when the summons was served.
At the time of what?
At the time when I was served with the summons.
All right.
Medical
Do
records.
you have those documents with you?
My lawyer has them with him.
All right. What are those documents?
The
I'm just handing her this notebook of medical records.
What's that?
We got the medical records right here, if you can see them, all of these.
All right. And those are the medical records for Billy Saunier from November of 2018 at Kennestone's WellStar Hospital.
Yes.
All right. What other documents have you reviewed?
That's it.
All right. Have you had any conversation?
Hey, Jim, I'm not sure you understood her first answer when she said the summons and the complaint and the affidavit. I mean, she read all that. I think she,
All right. Thank you, Paul.
thank you.
So you reviewed the medical records for Billy Saunier for November of 2018 from WellStar's Kennestone Hospital.
Yeah.
You've also reviewed the complaint and summons that were filed in this case.
Yeah.
Did you also review the labs that were filed in this case?
Yeah.
Including the HIT panel
Yes.
and the death certificate?
No.
All right. Any other documents that you've reviewed regarding Billy Saunier?
No.
Any other documents that you've reviewed regarding this case?
No.
Did you bring any documents with you to your deposition here today?
Besides the medical records that we just showed you, none.
Did you bring those or did your lawyer bring those?
My lawyer brought them.
All right. Do you have a copy of the medical records at home?
No.
And have you spoken with anyone other than your lawyer about this case?
No.
About Billy Saunier?
No. I'm sorry, can you hear me clearly? Because I feel like I need to speak a little bit more loudly.
Louder is better, and thank you for that. But I can hear you fine. Does that
Okay.
answer your question? Yes, ma'am. Now, in November of 2018, Billy Saunier was your patient.
Yes,
He was your patient at WellStar's Kennestone Hospital,
yes,
and he was administered heparin.
yes,
He was administered heparin under your supervision as his physician.
post-operatively
Yes,
As a-
ma'am.
as a prophylactic dose.
Yes, ma'am. And heparin is a drug,
Yes,
a drug that was administered to Billy Saunier in November of 2018
yes,
at WellStar's Kennestone Hospital.
yes,
Heparin is an anticoagulant
yes,
that's commonly referred to as a blood thinner,
yes,
and it's administered to reduce clotting.
to reduce the incidence of deep vein thrombosis.
Yes, ma'am. And ultimately clotting.
Yes,
Thrombocytopenia is a low platelet count.
yes,
Now, heparin has side effects,
yes,
like all drugs.
yes,
Some serious and some not so serious.
yes,
And one serious side effect of heparin is heparin-induced thrombocytopenia.
yes,
And that's abbreviated HIT or HIT.
yes,
And heparin-induced thrombocytopenia is nothing new.
Could you repeat that question again? I'm sorry, I didn't hear you very clearly.
Sure. Heparin-induced thrombocytopenia, also known as HIT, is nothing new.
No,
In fact, HIT's been well known in the medical community since the 1960s.
agree.
And that's at least 60 years now. It is 2022, right?
Correct.
So in 2018, that heparin-induced thrombocytopenia has a serious side effect of administering heparin, had been well known in the medical community for at least 50 years.
Correct.
Now, heparin-induced thrombocytopenia is the development of thrombocytopenia, right?
I'm not sure we heard that whole question, Jim.
Sure. Heparin-induced thrombocytopenia is thrombocytopenia or a low platelet count due to the administration of heparin.
Correct.
In Billy Saunier's case, it was due to the heparin that was administered to him in November of 2018 while he was a patient at WellStar's Kennestone Hospital.
Checkpoint.
You may answer.
Do you mind repeating the question again? for me?
Would you? Go ahead. I didn't mean to interrupt you.
Do you mind repeating the question again, please?
Would you read it back, please, Madam Court Reporter?
I'm sorry, just a moment. Is thrombocytopenia from a low platelet count due to administration of heparin?
The answer is no.
No. No.
No.
what?
No to the question. You said that low platelets of thrombocytopenia due to the administration of heparin. In context of this patient, there were other factors that could have led to thrombocytopenia.
Yes, ma'am. And what were those other factors?
Surgery.
What?
Surgery. The surgery he had.
Right. So surgery is also an explanation for Billy Saunier's thrombocytopenia or low platelet count.
So in the context of Mr. Saunier, having undergone cabbage ×2, surgery is actually one of the biggest reasons for thrombocytopenia that we see in patients after cabbage.
And are you saying that Billy Saunier's death was caused by his surgery and not by his heparin-induced thrombocytopenia?
No.
Okay. Billy Saunier died as a result of complications from heparin-induced thrombocytopenia. You agree?
No, I would not agree with that.
All right. And cite for me anywhere in the history of medical literature, I mean, textbooks, treatises, articles, peer-reviewed, non-peer-reviewed, grand rounds, throwaways, anything in the history of medicine for that proposition.
Thrombocytopenia in Mr. Saunier's case, one of the biggest factors was the surgery itself. Can thrombocytopenia and HIT lead to thrombosis? If you review the literature, if you review up to date, it can. But in this particular case, we cannot for sure say that the thrombocytopenia was almost entirely secondary to HIT, because the biggest factor was the surgery, and he had received heparin during the surgery, which is the standard of care for cabbage patients. And Dr. Myung is basically responsible for administering that heparin during surgery.
Well, is Dr. Myung responsible for Billy Saunier's death?
No.
All right. You agree that Billy Saunier suffered from thrombocytopenia, but it's your testimony under oath that it was caused by his heart procedure that performed by Dr. Myung and had nothing to do with the heparin that he'd been administered.
My testimony under oath is that Mr. Saunier died. Could HIT be one of the possibilities? Maybe, but there are other causes that were at play in Mr. Saunier's death. And we cannot entirely put the entire blame on HIT.
Sam, you answered that question. My question was a little different. Would you read back my question, please, Madam Court Reporter?
I'm sorry, I'm having a little difficulty here. One moment.
Hey, Jim, do you mind if I turn off notifications on my my email keeps popping up notifications. Do you mind if I take a minute and try to turn it off while she tries to find this question?
Do I mind if you turn off what?
My email, this is on my work computer, and my email keeps popping up notifications, and it goes, and I'm trying to turn it off. I thought I turned off the program. I don't know why it keeps doing it, but.
Well, the witnesses, we're still in the middle of a deposition. I'm not sure what if you want to do something with your computer, that's fine, as long as
Okay,
the
cool,
witness
thanks.
is still.
Yeah.
What's that?
She's still here. I'm just gonna, you can look at her while I do this. I'm just turning off the, I'm going into my, don't worry about it. It's okay. I thought I had turned this off already, but apparently I didn't.
Can I go ahead and read back the question?
Yes, please.
Okay. Do you agree that Billy Saunier suffered from thrombocytopenia? It's your testimony under oath that it was caused by his heart procedure by Dr. Mayang and nothing to do with the heparin that he had been administered.
Not sure if the thrombosis and the graft that was discovered at postmortem was entirely due to.
And what makes you testify under oath to that?
Because thrombosis in cabbage patients, specifically the fact that it formed at the graft site, could be secondary to the surgery, secondary to stasis of the blood there. So there are other factors that are playing a role here, and therefore the postmortem cannot tell us definitively that the thrombosis was secondary to HIT. So we are not sure about that.
You understand that your deposition is public?
Object to the form, I'm not sure that it is, but.
You understand that this is a public deposition?
When did that start happening?
You may answer, doctor.
I wasn't aware that this was a public.
Yeah, this is a public proceeding. This is not a peer review confidential proceeding. Were you aware of that before now?
Well, if you publicize your deposition, we're going to sue you. So go for it. I don't, it's not a civil action. It's not a public proceeding. I object. Trying to intimidate the witness with some illegal tactic.
You may answer.
She doesn't need to answer. There's no,
Were you aware this is
you don't need to
your deposition's public?
you don't need to keep repeating that she's under oath. She knows she's under oath.
But it's also public. Have you reviewed depositions on YouTube before, doctor?
No,
All right. But you're aware that they can be posted to places like YouTube.
no.
But what makes you think they can't and that this is not a public proceeding?
I just object to the form. How's it relevant?
You may answer.
I don't understand the relevance of this question since I am only involved in this case. I have just reviewed the documents that my lawyer has shown me.
Yes, ma'am.
I haven't really sort of looked into the fact that is it publicly open for everybody or gone on YouTube or anything like that. So the answer to your question is no. And
You
no.
did not realize that before now.
No.
All right. And now you do.
I'm not sure she does. I mean, you're saying that.
Courtroom, these are public proceedings. And
If
these
you-
depositions are public too.
If you want to put them on,
We'll file these in the court. They'll be public, available for anybody. We can publish them.
Miss Allen has a
You aware
copy
of that?
on these depositions.
Were you aware of that?
Don't answer,
You refusing to answer, Dr. Camphor?
advising or not to answer.
You refusing to answer on advice of counsel?
Yes.
Yes,
All right. So you said definitively, you can't say, and you testified under oath definitively that Billy Saunier's death was caused by heparin-induced thrombocytopenia. That's your testimony, right?
Objection confusing.
You may answer.
my testimony under oath is the following. Mr. Saunier's death, as the postmortem report reveals, was because of a thrombosis that was at the graft site. We cannot definitively say that that thrombosis was formed because of HIT or because of the surgery.
All right. So in your view, it was either HIT or because of the surgery, but you can't tell which one. Is that right?
That is correct.
Okay. And you agree that as a physician, you take a constellation of signs and symptoms into account when making diagnoses, right?
That's correct.
And you eliminate certain signs and symptoms in making that determination.
Are you talking in context to HIT in Mr. Saunier's, or are you just generalizing this question?
No, I'm talking about in every case, whether you're diagnosing HIT, which is heparin-induced thrombocytopenia, or tonsillitis, or a kidney disease, if you're a nephrologist, for instance.
Yes.
Okay. Doesn't matter what you're diagnosing. That's your training, your education, training, and experience. You're taught to do that, right?
Yes.
You take a constellation of signs and symptoms, and you make a diagnosis.
If I am the sole person who is the primary on the case, that is a correct statement. However, in Mr. Saunier's case, this is a co-management model where we took care of Mr. Saunier in tandem with Dr. Myung and cardiothoracic surgery, and Dr. Myung are wholly and solely responsible for administering, discontinuing, or starting another anticoagulation, because this is a cardiothoracic patient.
For starting and stopping what?
Starting anticoagulation, which the umbrella of heparin, stopping heparin, ordering HIT, starting argatroban. All the anticoagulation decisions are solely the responsibility of the cardiothoracic surgery, because they have performed the surgery, and we run a heavy risk of bleeding if another anticoagulation is started. And so all those critical decisions are made by cardiothoracic surgery.
In this case, that would be Dr. Myung.
That is correct.
When you reviewed the medical records, did you see any false entries?
Sorry?
False entries in Billy Saunier's medical record?
No.
Okay. Did you see any entries that look like they were in error, mistakes?
No.
I'll show you what we're going to mark as Exhibit 1 to your deposition. You see that all right? I'll show you what's been marked as Exhibit 1 to your deposition.
Can you enlarge the image, please?
Certainly. You see this? This is page 256 of 652 for WellStar Kennestone Hospital patient Billy Lee Saunier. Do you see that?
Right, I can see that.
Yes, ma'am. And I'm looking down here. There's an entry regarding heparin. Do you see that?
Okay,
See where it reads heparin, Forsun, injection 5,000 units / milliliter.
5,000 units. Yes, that is the entry for the subcutaneous heparin, not the therapeutic dose that you received during surgery, sir.
Yes, ma'am. And this reads electronically signed by Stephanie D. Bright on 11/19/2018 at 12:45. You see that, right?
Yes,
And it reads here, the ordering user, Stephanie D. Bright, PA, 11/19/18. So she ordered this heparin on November 19th, 2018. Is that right?
that is correct.
And it looks like there's some co-signing events. This is when folks signed off on that order, right?
Right, because Stephanie is a physician assistant, so all her orders need to be signed by Dr. Myung. And these orders were actually started in the ICU.
Objection, move to strike is non-responsive. See where it reads co-signing events electronically co-signed by Richard J. Myung, MD, 11/20/2018 at 13:08 for ordering. You see that?
Yes,
And what that means is that Dr. Myung co-signed ordering the start of heparin on November 19, 2018 at 1:08 in the afternoon. True?
it would, yes,
All right. And then number 2, electronically co-signed by William A. Cooper, MD, on 11/21/2018 at 11:04. That's 11:04 that morning, right?
yes,
That's continue on transfer. Do you see that?
yes,
In other words, they were to continue administering the heparin on transfer, right?
it would appear so. I was not responsible for the patient when the patient was in the ICU.
Right. When did you first become responsible for Billy Saunier?
I became responsible for Billy Saunier day 3 post-operatively or day 4. I'm not quite sure. I'll have to look at the records just to be sure on that.
Sure, have a look. Let me know.
And Jim, I'm just gonna hand her all the progress notes so she can find her first.
That'll be fun. I mean,
Thank
I've got my own idea about when that started too. If you're welcome to look at any of the medical records, doctor, and if you just let me know what you're looking at.
Your first day.
It seems like the first time I actually saw the patient, because the patient had already been accepted by our service the day prior on the 21st by Dr. Sedaria. I came on the 22nd, and that's when I started co-managing this patient with the cardiothoracic team.
All right. And that was on November 22nd, 2018.
That is November 22nd, 2018. My note is documented at 2:02 p.m.
Yes, ma'am. And what page of the medical record is that?
Page 93.
And that's page 93 of the 652 page record, right?
Yes, that's what I have in front of me.
All right. And you cared for Billy Saunier until his death.
I cared for Mr. Saunier till Sunday, till he was transferred back to the ICU, where then Dr. Myung becomes solely responsible for the patient.
So Dr. Myung became solely responsible for the patient again on the 26th.
Yes, so we have a co-management model with cardiothoracic surgery, where we as the hospitalist take over the patient after surgery, but it is a co-management model where they are totally responsible for the anticoagulation and any post-operative complications that occur with the patient. And so we work in tandem with them. And so once the patient is transferred back to the ICU, then the cardiothoracic team becomes solely responsible again.
You cared for Billy Saunier from the 22nd to the 26th.
The morning of the 26th.
And you're a hospitalist?
Can I go back? I think my lawyer is telling me it's from the 22nd to the 25th, sir.
22nd until the 25th. Well, you cared for him on the 25th.
Yes, but I initially said 26th, so I just wanted to make that correction.
So 22nd until the 26th, not on the 26th. Your last day caring for him was the 25th.
Yes, that's correct.
All right. So Exhibit 1, it reads here, electronically co-signed by Richard J. Myung on November 21st, 2018 at 22:23. That's 10:23 in the evening. Continue on transfer. Do you see that?
So you're probably showing me magnesium sulfate in water, 2 grams and 50 mLs. I think you probably need to refer to the heparin. That's the box above it.
Or the heparin?
Yes, I think what you read initially was the magnesium sulfate, sir.
No, I've been reading from heparin. You see that?
Yes, I see that. Electronically co-signed by Dr. Myung on 11/21/18 at 22:23 will continue on transfer.
Does that change any of your previous answers?
No.
Okay. I think the reason you just testified that I was talking about magnesium sulfate, because if you look under heparin, item 3, and magnesium sulfate, item 3, both read the same. Is that right?
Yes.
And now you realize we were talking about heparin, that box, right?
Yes, I am fully aware that we're talking about heparin, and so that is correct.
All right, and you realize that I've been reading from that heparin box, you called it, the entire deposition here today.
Yes.
All right. And beneath that frequency, Q8H, that means every 8 hours, schedule 11/20/18, 8 in the morning, until 11/25/18 at 10:07. Is that right?
That is correct.
So post-operatively, and we'll get into the preoperative as well. Post-operatively, Billy Saunier received subcutaneous heparin from November 20th, 2018 at 8 that morning until November 25th, 2018 at 10:07 that morning, right?
I would actually correct you there, sir, for a second, because he immediately goes on the heparin on 11/19. After he's had the surgery, he's received 16,000 units during surgery, and as soon as the patients come out, they're put on sub-Q heparin.
Right. Objection, move to strike is non-responsive. We're talking about the post-operative subcutaneous heparin. But you see this on exhibit 1 where it reads frequency?
Yes, sir.
All right. It reads frequency Q8H SCH 11/20/18 0800 to 11/25/18 10:07.
Yes, that's
All right.
correct.
And what that note means by frequency, that's a frequency of the administration of heparin to Billy Saunier while he was your patient, right?
While he was my patient from the 22nd to the 25th.
Yes, ma'am. And the reason heparin was discontinued on November 25th, 2018 at 10:07 is because you discontinued it.
That's correct.
It reads discontinued by Sonia Camphor, MD. That's you, right?
That's correct.
On 11/25/2018 at 10:07.
That's correct.
And that's what you did. You discontinued the heparin.
Yes.
And you did not start argatroban, right?
No, we did
did-
not. We did not.
Yeah, right. You did not start any non-heparin anticoagulant. Is that right?
We did not start any argatroban because his incidence was low probability, less than 1% on the 4T score.
His incidence, low probability, what?
We did not start the argatroban because we as a team, Dr. Myung, said that there was a low probability of HIT when we used the 4T score to define the probability of a patient having a HIT.
Mhm. And show me that in the record.
My note from the 25th,
Yes.
so my note from the 25th, page 131,
Right.
spoke to Dr. Klass, the hematologist, after having
Dr. Who? You spoke to who?
Dr. Klass, the hematologist,
Right.
and
This
had,
is your note on page 113, you said?
no, sir, page 132, 132, 132.
All right.
Spoke to Dr. Klass about the case and what the platelets were. And it was her expert opinion. And it was also the opinion of Dr. Myung. And if you read Delene's note from that day, Dr. Myung had actually gone in and spoken to the wife and said that we have a low probability, which would be defined by the 4T score as 0 to 3%, less than 1% chance. But in the spirit of being thorough, we were going to check that possibility out. Dr. Klass agreed with it. Dr. Myung said to order the HIT panel, which was ordered by Delene as stat, and the heparin was discontinued on the advice of cardiothoracic surgery.
All right. So we'll get to your note at page 132, and I see a reference to Dr. Klass. I don't see a reference to your conversation with Dr. Mayung there.
My conversations were with Delene Huff. She is the PA who works with Dr. Myung.
Mm-hmm. She's also party to this suit, right?
I'm sorry, what?
She's also a party to this lawsuit, right?
It,
If you know, if,
it would probably, if you say so.
now, I'm looking here at Exhibit 1 where it reads, discontinued Sonia E. Camphor, MD, 11/25/18/1007. I don't see where that note was co-signed by anyone. Can you show me that?
So if you could give me a minute to explain the co-management.
First, I'd like for you to show me. I see, with the drug ordering, continue and transfer, it was electronically signed by Richard Mayung, William Cooper, Richard Mayung, frequency, and then discontinued. That looks
right.
Just like you, according to the record.
Right. You're absolutely correct. I'm an MD. I don't need a co-signature from another MD because the heparin was started.
And you didn't get, and you don't have one here when you discontinued the heparin, right? There is no co-signature.
Which form?
May answer.
Prior answer, but go ahead.
I'm sorry.
This is a check form because you hadn't finished with a prior answer, but go ahead.
And that was Mr. Reynolds?
Was Mr. Reynolds.
Correct.
I'm an MD. I don't need a co-signature.
And you don't have one here, right?
So the reason I just explained, I'm an MD, just
Well,
like.
first, I want an answer to my question, then you can explain away. You do not have a cosigner on your discontinuation of the heparin on 11/25/2018 at 10:07.
No,
All right, go ahead.
I'm an MD. I don't need a co-signature. A PA, nurse practitioner who work under the license of an MD, they always need that note to be signed. If you review Delene's note, they all have been signed and co-signed by Dr. Myung or Dr. Cooper.
Have you ever prescribed ergotraban?
In the context of cardiothoracic surgery, no, till cardiothoracic surgery deems it necessary and is the sole responsibility of the cardiothoracic surgery to order the ergotraban.
Objection, move to strike is non-responsive. Can you hear me all right, Dr. Camphor?
Yes,
Have you ever prescribed ergotraban?
are we talking in context of this case?
Would you read back my question, please, Madam Court Reporter?
Yes. Have you ever prescribed Gatraban?
I have prescribed ergotraban only if cardiothoracic surgery deems it necessary. Otherwise, I have not.
All right. Have you ever prescribed fondaparinux?
In the context of this case,
Ma'am, did I say in the context of this case?
Lovenox, I have prescribed as a DVT prophylaxis.
Have you ever prescribed bivalirudin?
No,
All right. But you have prescribed argatroban.
in my recent memory, I haven't prescribed it. It is usually the cardiothoracic that prescribes it.
All right. Have you ever ordered argatroban?
The answer would be the same. I have not ordered it if cardiothoracic hasn't prescribed it.
All right. Have you ever ordered fondaparinux?
I have ordered Lovenox as a DPT prophylaxis if cardiothoracic surgery feels that that is the best route to go.
All right. I'm going to show you what we're going to mark as Exhibit 2 to your deposition. Can you see that, doctor?
Yes, I can.
All right. This is a summary of the heparin that was administered to Billy Saunier in November of 2018. You reviewed the medical record. You've seen these entries, all right?
Correct.
And Billy Saunier was first administered heparin on November 15th, 2018.
That's preoperative.
Yes.
I have no connection. I don't see the patients preoperatively, but from the records, it would seem that that is the case.
Right. And he was, he received that heparin via a drip. And this is at page 484 of the medical record. 3,000 units at 11 that morning, another 3,000 units at 11:18, another 1,000 units at 11:57. Then the next day, 30,000 units at 13:25, 30,000 units at 10:35 on November 19th, 2018. You see that?
I see that, but I also see it's preoperative and perioperative. Like I said, I'm not responsible for the doses of it and how it's administered. This is solely being driven by Dr. Myung's team.
Right. But when you care for a patient, it's important to know what drugs your patient is receiving.
Correct.
And what drugs your patient has received.
Correct.
And the reason that's important is because you're there for the care and treatment of your patient.
Correct.
And drugs can have adverse effects on your patient.
Correct.
And you want to do what you can as a physician to ensure that that doesn't happen.
Correct.
And you're aware too that in the case of heparin-induced thrombocytopenia, it can be 30 days after the administration of heparin that can develop.
I believe that's the literature.
Yes. And so that's why when you were caring for Billy Saunier on November 22nd, November 23rd, November 24th, and November 25th, and especially on November 25th, when the heparin was discontinued pursuant to the note we just looked at, to know how much heparin Billy Saunier had over the past 30 days.
I would only be concerned about the sub-Q dose that he's receiving. And also, I think your documentation doesn't show that he did receive protamine after, since we as physicians are responsible for making sure how much heparin he had received. There's documentation in the records that my lawyer has shown me that he did receive an antidote per me also. And so to answer your question that you asked me, we would look at the dose of the sub-Q heparin because that is all I'm going to be concentrating on.
So you were where when you cared for Billy Saunier in November 2018, that he received heparin on November 15th, 2018.
That's correct.
You were also aware that Billy Saunier had received heparin on November 19th, 2018.
That's correct.
And those are what you classified as preoperatively, meaning before the surgery, and perioperatively over the course of the surgery.
Right, therapeutic doses.
Right. And then after the surgery, the subcutaneous heparin was started. Is that right?
That is correct.
And that was on
The 20th.
the 20th of November, 2018. Right?
That is correct. It seems like it.
So you were aware that on November 25th, when you had the call with Dr. Klass, that Billy Saunier had been receiving heparin for at least the previous 10 days. Is that right?
Yes, because when we discussed the case with a hematologist expert, they are fully aware and we run the entire case by them. So that's correct.
Right. And you would take that into account when you discontinue heparin.
Correct form thing, Jim, take what into account? Sorry.
The heparin.
Okay.
So in Mr. Saunier's case, the order or the idea to stop the heparin has to be made in conjunction. He's not there. He's not there. He's just.
I can't hear the conversation. I mean, I can hear a conversation, but
Sorry, you leaned back and you disappeared. Dr. Camphor thought you were gone.
Oh, I'm here, Dr. Camphor. I appreciate your concern. I'm not going anywhere.
I spoke to Paul and said I can't see you. So I think to answer your
I can't hear you now, though. Something happened to the volume.
Can you hear me now?
Yes, ma'am, that's better.
Okay. I think to answer your question of stopping the heparin, that has to be made in conjunction with the realization of what the trend of the platelets are.
Yes, ma'am.
And so the trend of the platelets after when the heparin 5,000 units was started on the 20th, did not show a regular pattern of what we see in HIT as we have been talking about. It was a little bit of a yo-yo trend where it went down and then it started rising up again. I believe on either the 21st or the 22nd, his platelets had actually jumped up to 153, if I'm not mistaken. And then they went down to 141. So to answer your question, it is not an absolute science where we just stop the heparin because the patient, CABG patients, the mitral valve patients have received heparin during surgery. Like you alluded to earlier, we as physicians, we have to take into account the clinical data that's there, the signs and symptoms, and whether the trend is what we expect for what we are thinking in terms of a differential diagnosis.
Mm-hmm. You ordered the HIT panel on the 25th because you suspected heparin-induced thrombocytopenia, or HIT.
So I will correct you there, sir, for a second. If you look at your exhibit B, heparin-induced platelet antibody was actually ordered by Deline Huff.
Yes, ma'am. That was ordered because you suspected HIT, or heparin-induced thrombocytopenia.
That was ordered because Dr. Myung and Deline, who are the cardiothoracic lead on the patient, wanted to rule out every possibility for thrombocytopenia because there are several causes of thrombocytopenia, number one. Number two, his platelet pattern, as is evidenced in the records that you have sent us, they actually went up for 120 on the 20th when the heparin sub-Q was ordered to 153 on the 22nd when I received the patient. It went down very minor to 141. If we follow the 40 criteria, sir, this patient does not fit the 40 criteria of greater than 50% drop. And so all of these things have to be taken into consideration primarily by the cardiothoracic surgery for them to say, we need to go ahead and order the HIT panel. Which comes back to your question that you alluded to earlier when you asked me, did you start the agatroban? Once cardiothoracic has put in the order for heparin-induced platelet antibody, they have the full authority at that point if they deem it necessary to start the patient on argatroban. However, after consultation with the hematologist and with Dr. Myung, his risk was low probability, less than 1%, which the standard of care, as stated and up to date, you actually don't even need to stop the heparin. But Dr. Myung said to go ahead and stop the heparin, and Deline ordered the heparin-induced platelet antibody test at 11:07, sir.
You too had full authority to start the argatroban.
No, sir.
You did not.
No.
Okay. Show me where you were prohibited from starting argatroban on November 25th when you discontinued the heparin.
Sir, as stated earlier.
Yes, ma'am. First, I want you to show me where you're prohibited from doing that. Is that in the medical bylaws or in your, it's not in your credentialing file? Show me where it is.
I cannot show it to you, sir, but I can attest to it under oath that anticoagulation, starting, stopping in CABG patients and cardiothoracic patients is the entire responsibility of the cardiothoracic surgeons. Standard of care and up to date also clearly says that for CABG patients, anticoagulation needs to be discussed and conducted by cardiothoracic surgery after consultation with the hematologist.
Then why did you stop the heparin?
Because Dr. Myung's team said to stop the heparin.
Well, that's not in your note.
I believe I have written in one of my notes. I can't, if I have access to it, I can read it. And I clearly actually. I think there is, it is in one of my notes. Just give me a minute and I'll review it and I'll discuss it with you. Yes, so it is actually on exhibit page, it's on page 122. It is the 11th point that I have written, sudden drop in platelets from 141 to 115, repeat labs.
We're on page 122.
Yes, sir. Repeat labs in AM again, IFLO, HIT discussed with CTS, family aware of the drop in platelets, possible DC in AM if the platelets are normal, sir.
Page 122 of the medical record.
Page 122, it is my 11th point after constipation responded to suppository. Sudden drop in the platelets from 141 to 115, repeat labs in AM again, if low, order HIT, discuss with CTS.
Yeah, and this, in the lower right corner, does it say page 115?
No, for me, it says page 122. For me, it is page 122, sir.
It's her notes from 11/24, Jim. I don't know if the numbers are different.
Yeah, I'll pull it up.
Just when you get to a point.
Madam Court Reporter, what exhibit are we? I want to make this an exhibit to the deposition as well. Is that number 4? 3.
This will be number 3.
Thank you. All right, so this is number 3. Show you what's been marked as exhibit 3 to your deposition. And you see in the lower right corner where it says page 115?
Right, I see for you page 115. For me, it was page 122, sir.
So it sounds like we may be missing 7 pages of the medical record. Why are we missing 7 pages of the medical record?
I just think your pagination is different from ours. I don't know.
What date does yours say it generated on the lower left corner?
What page?
No, this is, yeah. No, this is where I speak to Dr. Klass.
Here it is, right here. It's page 122.
Yeah.
He's asking what day was it generated.
It was generated on 9/18/2020, sir.
I can't hear you.
Generated on 9/18/2020, 11:49 AM, sir.
It says generated on what date and time?
9/18, 9 September 18, 2020.
So 9/9/2020. And at what time?
9/18/20 at 11:49 AM, sir.
All right. And this is page 122 of the record you're looking at, not page 115. Right?
Correct.
It says on the lower right corner where it reads page 115 on exhibit 3 to your deposition, it reads page 122 in the document you're referring to.
Yes, the document I'm referring to is page 122, generated on September 18, 11:49 AM, sir.
All right. So when you're looking at 0.11 thrombocytopenia, platelet drop from 140 to 114 to 105. It happened on day 5, expected a patient received heparin, but the drop is less than 50%. We'll order HIT. That's the note you're talking about?
No, sir, I'm not talking about that note because the note that I'm referring to, I'm just talking about it from 141 to 115. The note that you are reflecting right now is the one that says from 140 to 114 to 105. I would assume that this is the day that we ordered the HIT because the note that I'm referring to is the day prior because his platelets were 153, then they dropped to 141, which wasn't a significant drop. But then the next day when I come and I see the 115, I discuss it with cardiothoracic surgery, which was delayed, and it was the decision made by cardiothoracic to repeat the labs in the morning again and to order the HIT, to which this is the note that you're looking at, sir. Thrombocytopenia dropped from 140 to 114 to 105. It happened on day 5 expected patient, but the drop is less than, will order the HIT. And this is after the discussion. Yeah. And that note actually on our paperwork is on page 131.
Yeah, but
So to put it all in context, the first step was the drop from 140 to 114. And that is when I pick up the phone and I call Delene and say, Delene, the numbers have dropped. She discusses it with Dr. Myung, and the plan is to repeat the labs in the morning again. And if it drops further, then to go ahead and order the HIT panel. The next day when I come, the platelets have dropped from 114 to 105. And that is what my statement says. And at that time, Dr. Myung has already gone in and spoken to the wife, as you can read through Delene's note, where Dr. Myung has clearly stated that the possibility of HIT, there is a low probability, but in the spirit of being thorough, we are going to get a HIT panel. That is when Delene called me, and that is when the heparin is stopped and Delene goes ahead and orders the HIT
I
panel.
can't understand you, ma'am. I don't know whether you're talking too close or what it is, but I can't understand you.
So walk me through where you stopped.
Still can't understand you.
Let's take a break. I need to go to the restroom. Why don't we do it? Can we get on to I think we should call in so that everybody can hear better on this, the phone in here.
What?
Did you hear that, Jim? Paul Reynolds has asked for a restroom break. We're going to call in so the audio is better, if that's
All right.
acceptable. Hey, Jim, this is off the record, but I think your document is labeled.
I can't hear you.
All right.
Say again?
The document that's up, which we can't see all the top of it, it's labeled something other than progress note. It's a discharge summary document. You go to the top. It's called discharge summaries and counter notes. It's a different document than the progress note that Dr. Camphor made. So just that's why they don't look the same. Anyway, we're gonna call in.
Yes, the audio connection is horrible. You're breaking up and I can't hear you at all.
We're gonna call in. It's
I don't know
nobody.
what that means. What do you mean you're going to call it?
We're gonna get on the telephones so that hopefully there's not an audio problem for the court reporter and you. It's nobody's fault. It's a function of Zoom and technology. We will call in. Tamika, we're trying to get it so you can hear us better. There's a phone number we can call in there.
You let me know when you're ready, Madam Court Reporter.
Whenever you're ready.
HIT is caused by the formation of abnormal antibodies that activate platelets.
Correct.
And if someone receiving heparin develops new or worsening thrombosis, or if the platelet count falls, HIT can be confirmed with specific blood tests.
Correct.
And those specific blood tests include an HIT panel.
An HIT panel, yes, correct.
And an HIT panel was performed here in November of 2018.
Yes.
I'm going to show you what has been marked as Exhibit 4. Is this Exhibit 4, Madam Court Reporter?
Yes, sir.
Thank you. this is the laboratory report for Billy Saunier from November of 2018 for WellStar Kennestone Hospital, 677 Church Street, Marietta, Georgia. Do you see that?
Yes.
This was ordered on November 25th, 2018 at 5:41. Do you see that as well?
Yes.
And if we scroll down to, you see where it reads heparin-induced thrombocytopenia, HIT antibody?
Yes.
AB stands for antibody, right?
Yes.
And it reads, there's an asterisk and it reads present, heparin-induced thrombocytopenia, antibody present. You see that?
Yes.
That indicates that's a positive test, right?
Yes.
Billy Saunier tested positive for HIT antibodies.
Yes.
Right? And that confirmed that Billy Saunier did suffer from heparin-induced thrombocytopenia.
That confirms that he had HIT.
And by HIT, you mean heparin-induced thrombocytopenia,
Correct.
HIT.
That's correct.
And it reads here, immediately beneath antibody present, patient expired. Do you see that?
Yes.
That's because Billy Saunier died, right?
Correct.
Billy Saunier died on November 26, 2018.
Correct.
It reads here, optical density. The normal range for those antibodies are 0 to 0.399. Do you see that?
Yes, I do.
And you see the H, that stands for high, does it not?
That's correct.
And his high was 3.501, right?
Correct.
So that was positive by a factor of nearly 10.
Correct.
And that confirmed what was suspected when the HIT panel was ordered.
Objection.
That Billy Saunier suffered from heparin-induced thrombocytopenia.
Same objection.
You may answer.
Billy Saunier had the diagnosis of HIT positive after the test came back, but before, when we were talking about it, his probability was low. It was only 1% probability.
Well, and we'll get into that. And you get that 1% from, walk me through the 1% calculation for Billy Saunier.
So, are you familiar with the 4T criteria?
I absolutely am familiar. In fact, we're going to walk through it today. And I want you to tell me how you get to 1% using the 4T criteria. Just walk me through it.
So the way we get to the 1% is we look at the drop in the platelet count, whether there is other evidence of thrombosis there, the timing of it, and if there are any other causes of it.
Right. I'm still waiting. Okay. So just walk me through to the 1%.
So within each category, there are at least 3 subcategories. For the platelets, if the drop is greater than 50% or if the nadir is greater than 20,000, but the surgery has not been performed. The second one is 30 to 50% drop in the platelets, and the nadir is somewhere between 10 to 19,000. And obviously, the third one is less than 30%. As far as thrombosis is concerned, is there any other evidence of thrombosis that was picked up on the patient? So it sort of subcategorizes in that. The timing of it, whether it was definitively 5 to 10 days, it was going on for 5 to 10 days, or it was less than 4 days, depending on the timing of the surgery. And last but not the least is the causes. Surgery, is surgery cause? DIC, is that a cause, or there was no cause whatsoever?
Other possible causes, I think you mean.
Yeah.
And so how did you get the 1%? I still hadn't heard how you arrived at the 1%.
So when we look at the drop, we start with the drop in the platelets. Is it greater than 50%? And was the nadir greater than 20,000? That's 2 points. If the drop is between 30 to 50%, that would be 1 point. And then if the drop is less than that, that would be 0. So he probably ends up getting a 1 there. Other causes, he probably ends up getting a 2. And
You said he gets a 1 there?
for which one are you?
I'm still, I was listening to you talk about his platelet count. Of course, you start the drop in platelet count from his normal platelet count, right?
So the drop in the platelet count is when he's exposed to the heparin. The first time he's exposed to the heparin.
Yeah, show me, cite for me any publication in the history of the solar system that says you start the normal platelet count at the beginning of the administration of heparin. Just cite for me a text, treatise, peer-reviewed article, non-peer-reviewed article, grand round, throwaway, anything. All right? Citation.
Right. Right.
I'd like a
So I think
citation. Yep.
right. So I think when we're talking about HIT, and we're going to be generally talking about HIT, if you go into up to date, what is the baseline platelets after the reception of, or after receiving the heparin is what we're looking at.
Yes, ma'am. I'd like a cite for that. I mean, I want you to cite me to any publication, peer-reviewed, non-peer-reviewed, anything that says the baseline is after you start heparin. Where can I look that up?
That's what I was trying to say. Like if you look up into up to date, it says, you know, where after the patient has received the heparin is when we start looking at the platelet count. I think your question specifically is what would be his baseline? We took his baseline from day 19. That's when he had the surgery. That's what we took his baseline going into surgery. What was his baseline?
Yes, ma'am. And I want to know where, again, any cite for me a publication. You pick the publication that says you start his baseline at the 19th, as opposed to before the heparin started, i.e. on the 14th.
I can't cite a publication as you're asking me the question. I would have to delve into it a little bit more before I can cite a publication.
All right, tell me where you would delve to find that information.
Where I would delve into is up to date.
Up to date, what is up to date?
Up to date is a medical literature site that we go to look at if we want some extra information or references.
Okay. Where else would you look?
I think that's the most easily accessible one. And that's the most easily accessible one that is available on the hospital EPIC website.
All right. All right, so I'm still trying to get to the 1%. Have you finished explaining to me how you arrived at the 1% probability that Billy Saunier was suffering from heparin-induced thrombocytopenia on November 25th, 2018?
Right. So I think when we look at the number of platelets, the drop in number of platelets, where we took his baseline,
what was his baseline?
His baseline on the 19th, I believe, was 180 something, but let me double check that for you.
So your testimony is Billy Saunier's baseline platelet count was 180 something.
Sir, I said, let me check because I
Sure.
think there was a whole. Okay, so on the 19th, on the 16th, his platelets were 185, and on the 19th it was 136.
Right,
And
and on the
19th
16th, Billy Sauniers had already been receiving heparin. He had already received 7,000 units of heparin by a drip on the 15th. And on the 19th, he'd received, in addition to those 7,000, another 83,000 units. And you're saying that you assess Billy Saunier's baseline platelet count after he's already had 87,000 units of heparin. Is that your testimony here today?
So my testimony here is I
First of all,
cannot
answer that
comment.
question. I want to know whether you agree that it's proper to assess Billy Saunier's baseline platelet count after he's already had on November 15, 2018, 7,000 units of heparin by drip, and on the 19th, another 83,000 units of heparin. And after he's taken on that much heparin, that's when you assess his baseline platelet count. Is that right? Is that your testimony?
Object to the form.
You may answer.
The
Go
answer is
ahead.
no. The answer is no to all what you have just said in the question. If I may be allowed to explain or to improve upon this.
Sure, and I want to make sure, I mean, my notes say you just testified that you start with his baseline, let's see, you start with his baseline platelet count after the administration of heparin. That would have been on the 19th or I guess 20th. That was your prior testimony, and we've got it recorded.
Right. So my test. Can I answer the question, please?
Sure.
So my testimony here is I will not be able to comment on the platelet counts, whether it was on the 14th, 16th, or 19th, or the 20th, because I wasn't involved in the pre or the peri-operative. I would have taken his baseline as 185. That was on the 16th.
185 on the 16th.
Yes, 185 on the 16th. I'm not sure that the 14th was, when was that 14th? Was it pre-operative? Where was it done? But 185 seems to be where he is definitely pre-operative before the surgery. That's on the 19th.
But you just said 16th, or 16th or 19th? What?
16th would be what I would use as a baseline. I'm not sure where the 14th was drawn and under what conditions it was drawn. Was it pre-operative? Was it drawn in a clinic? And I would also have to look at his baseline from before the 14th, if he had truly low platelet counts before that, or did he have or not. But 16th is what I would stand by. 14th, I'm not sure where it was drawn.
All right, so the 16th of November occurred, of course, after November 15th, right?
Right.
The 16th follows the 15th.
Yes.
The 16th is the day after the 15th, right?
Yes. Yes.
Right.
Yes.
So that if he had 7,000 units of heparin by drip on the 15th, then you would, it's your testimony that you assess Billy Saunier's baseline platelet account after the day immediately following the administration of 7,000 units of heparin. True?
I would not use any of this because I was not involved in the pre-operative period, sir.
Well, you're the one you brought up. I think you said, what was it? The four, let's see what this is. I think you called it the 4T score, is that right?
Yes, sir.
And the 4T score, you said that there were 4 elements to the 4T score, right?
Yes, there are 4 elements of the 4T score. It's the thrombocytopenia, platelet count of greater than 50%, and a nadir of greater than 20,000.
The strike is non-responsive. My question's really, I think, fairly straightforward. You brought up in your testimony here today under oath what's called the 4T score, right?
Yes,
The 4T score for heparin-induced thrombocytopenia.
correct.
And you testified a moment ago, there were 4 elements to that 4T score, hence the number 4, right?
That's correct.
And the first element is thrombocytopenia.
That's correct.
The second element is timing.
Correct.
The third element is thrombosis.
Correct.
And the fourth element is possible alternative causes of the thrombocytopenia, right?
Correct.
Those are the four T's. Now, the first one, thrombocytopenia, you agree it's 2 points if the fall in platelet count is 50% of the previous value.
Object to form.
You may answer.
Go ahead.
Platelet count greater than 50% and nadir of greater than 20,000, provided there has been no surgery.
Right. And it's 1 point if the fall is 30 to 50%, right?
Right.
2 points if the fall is greater than, you said greater than 50% or greater than equal to 50%?
Greater than 50% per the 4T criteria, sir.
All right. And where do you get the greater than 50%?
Can you explain what you mean by that? It's in the
Sure, where do you
criteria.
get the greater than 50% as opposed to the greater than or equal to 50%, which is what is in the WellStar Kennestone Hospital's policies and procedures regarding heparin and HIT?
Well, I get the greater than 50% from the up to date, sir. Up to date.
Okay, show me where's the up to date. Are you looking at up to date now?
Yes, actually, I am looking at up to date. Do you have access to up?
No, send me just email me a link to what you're looking at. I'll pull it up.
Okay.
Hey, Jim,
Yes,
I'm on, best I can do, I think, is take a screenshot of it.
well, I
I've
need a
got-
link to it. I'm gonna need to access it and, look around.
Subscription to up to date. I don't know that you can get on up to date without a subscription. So I don't know. how to do
This is
that.
what, this is WellStar? I mean, this is WellStar system?
No, I have an account with up to date. You have to pay
Oh.
for a subscription.
Got it.
I
Okay.
don't
Just
know.
send
that
me,
you-
I'm sorry. Go ahead, Paul.
No, I'm sorry. I don't know that you can get on it without a subscription. I'm gonna take a picture of what I'm looking at.
That's fine. If you don't mind, go ahead and just send that in chat. I mean, I assume you noticed earlier that when I mark exhibits, I go ahead and send them to everyone in chat.
It's on my computer.
Let me
It's-
figure
Just
out
do
how to
this.
do.
If you just do that, we'll go ahead and mark that as exhibit. I think it's 5, Madam Court Reporter. Is that right?
He's not on this chat. It's with his cell phone that he's taking a picture of. It's not on this computer, so there's no way that we can just put it in chat.
Well, I can do it. You text it to me on my phone. I'll have it up there in 30 seconds.
I
Cool.
texted it to you.
All right. I don't have it yet.
Well, I can't.
I'm texting it again.
Well, I mean,
Did you text it to 404-307-4400?
whatever cell number I've been using for you, let's see. It may take a second to get there, Jim.
All right.
Has it gotten? Let's see.
Last I got from you was all right. And that was at 11:40.
All right. All right. I just sent this at 1:21. It may take a minute. It's pushing through on my phone.
There you go.
It's not,
All right, I'm gonna run the men's room. I'll be right back.
just not through yet.
So, what's that?
It's just not going, it
Got
hasn't
it.
gone through.
All right, I'll be right back.
Jim, are you there?
Yes, sir.
It says it was delivered, Jim.
Sir?
It says my text was delivered to
I
you.
got it. Hold on, let me pull it up for everybody. All right, did that come through? We'll make that Exhibit 5, Madam Court Reporter, which is Mr. Wethington's screenshot that everybody see that now?
Yes,
All right. So this is what you described as the 4 keys, what we marked as Exhibit 5, is that right?
yes.
All right. And the 4 keys, I don't see what you're scoring, but do you agree that if a score, go ahead. Yeah. A score 4 to 5 indicates intermediate probability, while a score of 6 to 8 makes it highly likely the patient is suffering from heparin-induced thrombocytopenia or HIT. True?
Yes.
And the platelet count, do you have anything in that, whatever you're referring to, that says you start the baseline platelet count for the patient after 7,000 units of heparin drip?
No, there's nothing to that effect.
Okay. Well, is there anything in there that you can go ahead and take a screenshot of that says you assess the patient's baseline platelet count after you give them 7,000 or so units of heparin drip?
No, there's nothing there.
Okay. Do you agree that 104 is 50% of 208? You there?
Yes, I am.
I believe you're frozen again on my screen.
It's frozen.
You're now you're okay.
For 50% of 208, just a math question.
Yeah.
Yes,
104 is 50% of 208, right?
yes,
And Billy Saunier's platelet count on November 25th was 104.
correct.
And Billy Saunier's platelet count on 14 November before the 80,000 units of heparin on the 15th and the 19th was 208.
It appears to be the case.
Right. So assuming that you take a patient's baseline platelet count before you administer 80,000 or even 7,000 units of heparin, his fall from 208 to 104 would be 50%. True?
Excellent.
You may answer.
It would appear to be, however, his platelet counts went up on the 22nd.
And your point with that is what?
My point on that is that he didn't have a consistent drop of greater than 50%
Okay.
or a drop of greater than 20,000 nadir. His drop from 208 to 185 to 130, we see these sort of drops commonly post-surgery.
Yeah, I'm looking at element 1 of the 4 T's on exhibit 5, and show me where it says it makes a difference if the platelet count goes back up before it drops. Can you show me that? I just don't see it there.
Right. It doesn't show on the 4T. You're correct.
Gotcha. All right, I'm moving on. So you give a score here of 1 point under thrombocytopenia?
Yes.
All right. Then the timing of the platelet count fall, you agree that the platelet count fall was between 5 and 10 days of heparin exposure, right?
Yes, but coming back to your earlier question, where does it show in the 40 criteria about the fall, the consistent fall? Timing of the platelet count fall, if you see option B, it says consistent with fall in the platelet count at day 5 to 10, but so there wasn't a consistent fall.
It doesn't say consistent fall, it says consistent with fall. You see that?
Right, yeah.
The platelet, Billy Saunier's heparin was started on the 15th or the 19th.
I would have to check that because I didn't start the heparin. I believe from what we have here, it was started on the 15th, 3,000 units IV given during catheterization when he had the cardiac cath done.
All right. So the timing of the platelet count fall was between 5 and 10 days.
It would appear so.
And that's a count of 2 for the timing of the platelet count fall, right?
It would appear so.
And So that's 2 + 1 under thrombocytopenia, and you've got a 1 under thrombocytopenia because it says greater than and not greater than equal to 50%. If it was greater than it's equal to 50%, that'd be another 2 points. Is that right?
Just object to the form.
So the platelet count fall greater than 50% and a nadir of greater than 20,000, provided there has been no surgery. So he does not meet the first criteria.
Doesn't it? There's a platelet count fall of in your view, 30 to 50%, right?
Right.
Which is 1 point.
Right. Are you talking about the first point or the second point? I'm getting a little confused here. Are you referring to the platelet count fall of greater than 50% and a nadir of greater than 20,000, 2 points? Are you talking about the 1 point, sir?
Using your scoring, Billy Saunier scored under the 4 T's element 1 thrombocytopenia a 1, and under Tom a platelet count fall a 2.
No.
It depends on the baseline you're using. But
Hey, now, whoa, Paul, you're not sworn in yet. Go ahead, Doc.
Right. So there isn't exactly a clear onset that we can see that it was exactly 5 days, because the first time we see an absolute 50% drop from even 208 or 185 is on the 25th. So it's not a clear onset. We can say it is somewhere between 5 to 10 days, but not a clear onset.
Well, 208 to 104 is 50%, right?
Right.
All right. Element 3, thrombosis or other sequelae.
There was no confirmed new thrombosis, skin necrosis, or acute systemic reaction after the intravenous unfractionated heparin bolus. So it doesn't get any points for that. Progressive or recurrent thrombosis or skin lesions doesn't get any points for that. None gets 0 points for that.
And your note, we'll go through your notes in a bit, but you don't remember writing about the skin rash in your notes?
Off the top of my head, I can't remember writing about a skin rash.
All right. And the other causes for thrombocytopenia present, you would score that as 2, or you're saying 0 because he had surgery?
I would score it as 0 because he had had surgery.
And give me a cite for that. Anything in the history of medicine, texts, treatises, chapters in texts, peer-reviewed articles, non-peer-reviewed articles, grand rounds,
Right.
throwaways, medical school buddy comment, anything. I want to cite to anything.
Absolutely. So I think I'm going to give you if you can just bear with me, there is a totally different approach to patients with HIT in cardiopulmonary surgery.
What are you reading, doctor?
Sir, I'm reading it from Up to Date. If you can just give me a minute, I'm just getting to that.
What page are you reading from now?
It's the Up to Date page, sir.
she's trying to find it.
No, you're on a different page though.
Yes.
All right, well, I'm gonna need whatever you're using, whatever you're referring to help you with your testimony. I need a copy of that.
Sure. So there is management of heparin-induced thrombocytopenia during cardiac and vascular surgery. Authors are Thomas L. Ortel, MD, PhD, and Mr. Welsby. And it has been cited in the literature. It is current to December 2021. The topic was last updated on October 28, 2021, sir.
All right, send me a copy of that.
Right.
Jim, I don't know if I can print the whole article sitting here.
Well, just send me the article, or hell, I'll pull it up. Let me pull it up.
It's called Management of Heparin-Induced Thrombocytopenia During Cardiac or Vascular Surgery. And the authors are, I'll spell the last name out, O-R-T-E-L.
Hold on. This is an article. Where is it published?
Up to date, sir.
Okay. Well, up to date, it's just a compendium of articles, right?
No.
No.
This
No,
is
it's not.
this is written by somebody, a staff writer at Up to Date.
No, so these are MDs that have taken and reviewed all the literature that there is to be reviewed, and they have given their opinion in terms of what should be the standard of care.
All right, and who are the authors?
So the authors are O-R-T-E-L, Thomas L. O-R-T-E-L,
All right,
That-
who else?
and the last name is W-E-L-S-B-Y. First name is Ian. So they have written this article for Up to Date, and they have made their recommendations based on just give me a minute. I'm just going to tell you how many papers have been included in this article. So there are approximately as far as the references are concerned, so there are approximately 51 references.
That's fine. Go ahead and send me a copy of the article.
Hey, Jim, I need to figure out how to do that.
All right. Did you review this article before your deposition today?
Say that again?
Did you review this article before your deposition today?
No, I haven't reviewed this article before the deposition, but because I work with the cardiothoracic surgeons periodically, I review the articles or discuss it with Dr. Myung's team.
So what happened over the course of your deposition today is Paul Wethington, your lawyer, pulled this up on the computer and you referred to it to answer questions. Is that right?
I thought you clicked on it.
I know I clicked on it. How would Paul know about it? I'm the one.
You brought your computer to the
No, sir.
deposition?
Say that
So
again?
you brought your computer with you to the deposition today?
No, she's doing it on my computer, Jim.
And I misunderstood. I thought, Paul, you said you had a subscription to Up to Date, and that's how you were accessing those 4 Ts that she referred to earlier. Did I mishear that?
No, you heard it right. I pulled up to Date on General HIT, and then she clicked on a link in that article, and it went to this article. So she
Gotcha.
found this.
And where your 4 Ts, what article is that in?
Where were we at before?
I
Well,
think
first of all, go ahead, Paul, do whatever you need to do to get me this article she's talking
I'm
about.
going to get a screenshot of this one to start with
Okay.
while we try to figure out how to send it to you, okay? Reynolds, you know how to send it?
I think so.
Jim,
Yes, sir.
I just sent a screenshot of the title of this article.
All right. Now, Dr. Camphor, is there also a section in there on discontinuing heparin and not starting a non-heparin anticoagulant?
Sir, I did not review this article before coming for this deposition. And I would not be able to answer that question.
Okay. All right, so back to the 4Ts. You went through your view of the 4Ts and you said that the likelihood of Billy Saunier having heparin-induced thrombocytopenia, notwithstanding what his HIT panel showed, was 1%. That was your testimony here today, according to my notes. Is that right?
That's
1%.
correct. Low probability 0 to 3%. That would give him a 1% chance.
And you arrived at the 1%?
Because how it's graded, low is 0 to 3, intermediate is 4 to 6, and high probability is greater than 6, and then it gives you percentages after secondary to that. 1%, if you go through the 40 criteria set.
And your baseline for the first criteria started after the administration happened, right?
My baseline started at 185, or what was before he started the heparin. The heparin, I believe, as I reviewed the notes, I believe the first time you received the heparin was on the 15th at about 11 o'clock. So whatever his heparin was on the 15th before the heparin started, I don't know if there is a lab that was drawn on the 15th.
Right. You agree that the treatment of heparin-induced thrombocytopenia requires two things. First, stopping the heparin treatment, and two, administering a non-heparin anticoagulant.
Is this in context with this particular patient or just general?
Just answer the question as best you can. And if you don't know, tell me you don't know.
So to answer your question, if it
Sure.
was not a cardiothoracic patient, that would be correct what you said. But if it was a cardiothoracic patient, starting in our Gatroban carries the risk of bleeding, and that needs to be discussed with a cardiothoracic surgeon.
Okay. So if it's not a cardiothoracic surgeon, wait, did you say surgeon or surgery? Surgery, right?
Yes, I said
All right,
surgery, cardiothoracic surgery.
All right. If it's not a cardiothoracic surgery patient, the treatment of heparin-induced thrombocytopenia or HIT requires two things. For one, stopping the heparin treatment, and two, administering non-heparin anticoagulant. True?
Sort of true, because you have to look at the 40 criteria also. You would not start an argatroban if it's a low probability.
Well, if you suspect heparin-induced thrombocytopenia, you have to treat it as if it's heparin-induced thrombocytopenia. True?
If the patient doesn't have a low probability.
Well, if you order a HIT panel, it's because you suspect heparin-induced thrombocytopenia. True?
Alert
Not
from
true,
calendar.
but-
Upload Depo video to YouTube channel.
What's that?
I didn't answer that.
Nobody said that. That was something that came from the computer.
I didn't say anything.
Said something about a YouTube channel.
Okay, go ahead. That's my machine. I'm waiting for your answer.
Right, absolutely. So basically, we stop the heparin. We use the 40 criteria. If it's a low probability, the recommendation, actually, the standard of care is to continue monitoring the patient, and you can continue with the heparin. It's only when the intermediate probability is there and you've discussed it with all the experts, then you can stop. But if it's a low probability, the recommendation, sir, is not to start the argatroban. The recommendation is to continue monitoring.
All right, and give me a site for that being the standard of care.
Can we just go back to the original 40 criteria that Paul sent you? Can I reference?
Yeah, I want every publication, every treatise, textbook, peer-reviewed article, non-peer-reviewed articles, rounds, grand rounds, anything that says when you suspect HIT, the standard of care requires you stopping the heparin and not starting a non-heparin anticoagulant. That's what I want it right now.
Object form.
You may answer.
So yes, I will give you the answer, sir. I will send you a picture or a snapshot of the algorithm that states what I'm stating for you.
All right.
Go back to the Fulton.
That's a different art. That's a
No,
different.
no, just go ahead. It's right. Yes, that's it. That's it. That's the one. That's the one. Right. That's the one.
I don't have it up.
Just if you can send a picture.
So you're sending me a couple, Paul? Hold on, it looks like I got one of them.
I sent you something. I sent you that one article. I was trying to email you the whole up to date.
Jim, I have the up-to-date that I've pulled up that has an algorithm. I don't know if this is what she's talking
Yes.
about. I don't know if it's her testimony. I don't have any idea. Do you want her to look at it? Do you want her not to look at it? What do you want to do?
Well, is it an article that
all
you
read.
relied
I
on,
have-
Doctor?
Pardon? What'd you say?
I had a question.
We didn't
Dr.
hear it.
Camphor, is this an article you relied on?
Is the article, that's the HIT article or a thrombocytopenia induced antibody article that everybody relies on when they go in up to date, sir.
Okay, yeah, let me see that. That's for the proposition that you stop the heparin, don't start a non-heparin anticoagulant, and wait and see what happens, right?
No, sir. My testimony today is, I want to be emphatically clear on this. My testimony today under oath is that we look at, when we suspect it, we also look at the 40 criteria. If it is a low probability, the standard of care as stated and up to date is if it's a low probability with less than 1%, if you go down the algorithm, it says you can actually keep on continuing with the heparin if it is a low probability. Of course, if it is an intermediate probability or a high probability, we will stop the heparin and start the argatroban. But the decision to start the argatroban is a decision that is taken by the cardiothoracic surgery.
All right, so you stopped the heparin in this case.
We stopped the heparin after Dr. Myung told me to stop the heparin.
And you stopped the heparin in this case because you thought it was a moderate probability.
No, I stopped the heparin in this case because, as stated in the lien's note, Dr. Myung felt it was a low probability, but because the spouse was extremely upset, we wanted to make sure that it was a thorough investigation that we had to do so.
Well, you just testified, Dr. Camphor, that you stop the heparin if it's a moderate probability. You said you could continue the heparin if it was a low probability, and you didn't continue the heparin in this case. You stopped it. True?
I stopped the heparin after Dr. Myung said to stop the heparin. Yeah.
Well, I didn't show me the note in the medical record right now where it says, well, first of all, did you talk to Dr. Myung on your mobile phone in November 2018?
No, sir. I spoke to Deline on the Spectra links that we have in the hospital.
Show me in the record where you spoke with Dr. Myung and he told you to stop the heparin. Show me that.
If you can give me a minute, we'll have to
Sure,
go through it.
It'll take a minute. I'm gonna, I'll be back. How long you need? 5 minutes? Is that long enough?
Yeah.
All right, see you then.
Email me that article.
Yeah, can we stop the recording when we're off the record?
I'm moving. I'm moving.
She's unfrozen.
What?
She's moving now. She ain't stuck.
Did you speak with either of your lawyers over the course of that break?
Which break are you referring to, sir?
The break we just took for you to find in the medical record where you spoke to Dr. Mayung about stopping the heparin and not starting a non-heparin anticoagulant.
Sir, I just went through, my lawyer showed me my records, and I can refer you to where I wrote in my note, and it's page 122.
First of all, ma'am, my question, can you hear me all right?
Yeah.
My question was whether you spoke to either of your lawyers over the course of that break.
You told us to take 5 minutes and find the record.
Right? That's not my question, though. My question is whether you spoke to your lawyers.
Well, I have to speak to him to get me the paper that shows my notes, because
Okay.
he has the records with him. So I do have to at least make that statement to him that, can I have a look at my progress note?
Did you speak to either of those lawyers about your testimony here today?
No, sir.
Okay. All right. So you're going to show me in a record where you had this conversation with Mayung?
No. So it's on my end, it shows page 122. It is my note from the 24th. It is the 11th point where it
Hold on
says-
1 second. I need to pull this up. You said you're on page 120. What is it?
Page 122.
Okay.
This note was written on the 24th of November.
Uh-huh.
And so it is the last point. It is number 11, where it stated sudden drop in the platelets from 141 to 115. Repeat labs in AM. Again, IFLO order HIT. Discussed with CTS. Family aware of the drop in platelets.
Is that, it's up on the screen now, right? That's page 115 of Exhibit 2?
No, sir, that is the discharge summary that you are showing me.
You said page 122?
Yes, sir. What you are showing me is a discharge summary, sir.
All right, I'm looking at page 122. See in the lower right corner, page 122 there?
Yes, it says 122 right here, page 122.
Let's. All right, well, send me a copy of what you're looking at.
Can I speak to my-
Exhibit to your deposition. What?
Can I speak to my lawyer about it?
Sure.
I'll take a picture of it, Jim. Bye.
All right. Where are you, Marietta?
Yeah. I sent it to you.
All right. Email or text?
I texted it.
That's fine.
I think it went through.
Yeah. The page is cut off though. Can you take a shot? You mind kind of putting it more over it? So we get
Yeah. I'm not a good photographer.
I think you're probably just fine, Paul.
Yeah. Let's see. Back up there.
Yeah. Yeah.
I hope that's got the page number on it.
Thank you.
You're welcome. . 。
All right, is this it?
Yes,
All right, Madam Court Reporter, is that number 6?
Yes, sir.
Thank you. So this is the note, Exhibit 6 to your deposition at page 122 of the medical record shows where you spoke to Dr. Mayang and he instructed you to discontinue the heparin and to not start a non-heparin anticoagulant, right? Show me that, please.
no, this is the note where it says, I believe your question was where you had discussed it with cardiothoracic. It shows sudden drop from 141 to 115. Repeat the labs in AM. If low order HIT panel, discuss with CTS. At that point, we did not have the discussion of stopping the heparin because as you can see from point 11, CTS is still saying we need to monitor the trend. On the 25th is when the heparin is stopped.
DWCTS, what is CTS?
Cardiothoracic surgery, sir?
Right,
DW
that's what he had. He had cardiothoracic surgery. That's what that is.
No, sir. Cardiothoracic surgical services. That's what it means. Cardiothoracic service. That means Dr. Myung and Deline, sir.
DWCTS means what?
D/W is discussed with.
Uh-huh.
CTS, cardiothoracic service, sir.
Uh-huh. And that's Dr. Mayang is your testimony?
Dr. Deline and Deline spoke with Dr. Myung.
Okay, so you didn't speak to Dr. Mayang.
No, don't
Okay.
directly
You
speak to
spoke with
Dr. Myung.
Deline Huff.
Yeah, because
And when-
Dr.
And when you testified earlier, you spoke with Dr. Mayang, what you meant is you spoke with Deline Huff.
Yes, we speak with Deline through the spectral link, sir.
All right. And here it says if low order HIT, by that you mean the HIT panel, right?
Yes, sir, that's correct.
And the HIT panel was ordered on the 25th, right?
Yes, sir.
All right. And I'm still looking for the part where it says discontinue heparin and do not start a non-heparin anticoagulant like argatroban. That's not on this page, right?
No. That's not on that page.
Okay, so you go ahead and show it to me and we'll go from there. I don't know if you want to be in the video,
page-
Paul, but yes, go ahead. What?
Page 132, sir, page 132.
Yeah,
If you look at page 132, it is a pretty expansive sort of a summary of what has happened. And where it says no heparin due to low platelets and no Plavix, it was stopped, sir.
page 132, is this consults and counter notes?
No, sir, it's my note, page 132, sir. It is progress note, page 132, sir.
It says 132 in the lower right corner.
Yes, sir.
Yeah, I've got to, let's see if I can figure out. Let's see. I'm going to go up 7 pages and see if we can get close. All right, I'm at page 139. Is that a certified, this says it's a certified copy of the medical record. Does yours also say it's a certified copy of the medical record?
Sir, this is the copy that my lawyer is sharing with me, so I would say yes.
All right, so go ahead and send me a copy of whatever you're looking at. We'll add it to as an exhibit to your deposition.
Just texted it, Jim.
Thank you, Paul.
Welcome.
Says page 132.
Yes, for me, it is page 132, the page that's been provided to me by my lawyer.
All right, we're going to make this one exhibit 8. Is that right, Madam Court Reporter?
That should be exhibit 7.
Oh, got it. Thank you. There we go.
And
All right, we're going to pull this one up. This is, it says page 132 in the lower right corner. You see that?
yes, 132, that is it, sir.
And this is your note where it reads, it says Sonia Camphor, MD, DVT
Right.
prophylaxis, no heparin due to low platelets and no Plavix. You see that?
Right.
That's your
Yes,
note.
sir.
right? That's your order.
And-
That's your order, right?
That's not an order, sir, that's just a progress note, but the order was placed after, if you look at cardiothoracic note for that day too, Delene clearly writes it in her note that heparin on hold, HIT sent. So doing exactly what cardiothoracic surgery had asked me to do.
Okay, and show me here where it says that it wouldn't be Dr. Mayon because you never spoke with him. It would have been Delene Hoff, right?
Yes, because
Okay.
Delene,
And show me where it says Delene Hoff or from cardiothoracic surgery told you to stop the heparin and not to start a non-heparin anticoagulant. Show me that, please.
Well, I don't have it written where I say that the lead told me, but as you can, I can share the page. It's 125 on Delene's note where it clearly
Wait a minute,
says-
we're looking, it says page 132. I thought, is it on this page or is it not on this page?
So what I'm referring to is on page 125, sir.
Okay, well, Paul, will you send me that? And we'll mark that as Exhibit A. So the last two documents, though, it's not on those documents, you agree, right?
The fact that I have spoken to Delene, is that what your question
No,
is?
the
sir?
question, I mean, it's the same question. It's, you're going to show me in the record. Well, earlier you testified it was Dr. Mayung. Now you testify that you never spoke with Mayung, but you said Delene Huff at some point told you to stop the heparin and not to start a non-heparin anticoagulant. That's what I want you to show me in the record, where you were told to stop the heparin and not to start a non-heparin anticoagulant.
Right. In the record on the 25th itself, there is no documentation from me that I had spoken to her, but what we have just sent you is that Delene wrote in her note to stop the heparin. She spoke with me on the Spectra link and I stopped the heparin.
Okay, well, let's pull that up. So we're all playing from the same sheet of music. I'm no musician, but you're all right if I use that phrase, right?
Sure.
All right, this is going to be exhibit number 8. It's got all those colored tabs. The page is cut off on that one, Paul. Do you mind sending me one with a page on it?
Sorry, I'm not a good photographer.
What I do is hold the phone right over the thing and just try to square it up as best I can, but. You gotta give me a little room to edit there, Paul.
I resent it, Jim.
Beautiful, man. Now that's some fine work. So this is the real exhibit 8, right? Well, we'll call this what, 8.1? Court reporter.
You want it marked as 8.1?
Or you just make this 8 and delete
Yeah,
that.
delete the other one. Yes,
Got
sir.
it. Thank you. All right, so now we're looking at exhibit 8 with the page number down here in the lower right. You can see that it's page 125. Is that right? You see that? You see that, Dr. Camphor?
Yes, sir. Yes,
Okay.
sir.
And this is the one, so you're going to show me here where it reads that you were told to stop the heparin and not to start a non-heparin anticoagulant. That's what we're looking for, right?
The purpose of showing you this document is to show you that Delene wrote this note. It clearly shows heparin on hold, HIT sent. I hold the heparin. I documented in my note. As far as the conversation is concerned, that conversation took place on a Spectra link. I haven't documented that, sir.
So I didn't understand it. Did you say you did not document that you were told to stop heparin and not to start a non-heparin anticoagulant?
Yes, I did not document that per se sentence in any of the notes.
Gotcha. All right. And you agree that, I lost you. Can you see me?
Yes, I can see you. You're frozen.
I can't see you. I don't know what happened. Paul, are you there?
Yeah, we see you.
There we go. Okay, you're back. You
Okay.
agree?
phone,
What?
but It's part of the benefit of the phone, I think, but go ahead.
What was that? That broke up a little bit.
Nothing, just go ahead.
Any other portions of the record that you contend show that you were told by Delene Huff to stop the heparin and not to start a non-heparin anticoagulant?
No, I think that no. The answer is no.
Now, you agree that your patient's safety comes first,
Yes, sir.
right? And I mean, the last thing you would want to do is endanger your patient. True?
True.
And there's nothing anybody could tell you, not Dr. Mayung, not Delene Huff, not another physician, not a nurse. There's nothing they could tell you to do that you would do if you thought that that would endanger your patient. True?
True.
You would never intentionally endanger your patient, right?
No, sir.
And you agree that when you suspect heparin-induced thrombocytopenia, if even if your level of suspicion is low, physicians can turn out to be wrong. Is that right?
That is correct.
Right. And if your patient is suffering from heparin-induced thrombocytopenia, which the HIT panel proved after it already died that was the case, right?
Correct.
If you suspect that and you go ahead and stop the heparin and start a non-heparin anticoagulant, that's going to be the safest thing to do for your patient, right?
No, I disagree with that.
Okay.
Because in this particular case, this is post-operative day 4, post-operative day 5. If we start the argatrobanza, one of the most serious complications is intracerebral hemorrhage, and the patient can bleed to death. Therefore, such decisions, particularly in Mr. Saunier's case, need to be discussed in conjunction with a cardiothoracic surgery and hematology, sir.
Okay. So this is actually, the surgery was on the 19th. Let's make sure we get the dates right to start with, right? Surgery was on the 19th?
Yes, sir.
So post-operatively, this is the only way I know to do it. It's like this: the 20th, 21st, 22nd, 23rd, 24th, 25th. Is that right? Is that 6
Yes,
days
sir.
post-op?
Yes, sir.
So this is a 6-day post-op. Is that right?
Yes, sir.
And it's your testimony that it's safer to stop the heparin and not to start a non-heparin anticoagulant when you suspect heparin-induced thrombocytopenia. That's the safest thing to do for the patient.
No, sir. That's not my.
Object to 4.
You may answer.
No, that's not my testimony today, sir.
Okay, then it's safer to start the non-heparin anticoagulant.
Same objection.
No, sir. I would emphatically deny that. That is not what I said.
Well, what you did was stop the heparin and not start a non-heparin anticoagulant. You felt like that was the safest option for the patient.
I would emphatically deny that statement, sir, because
Well,
the
but that's
decision.
what you did, right? That is what you did. You stopped
sir.
the heparin and did not start a non-heparin anticoagulant.
I would disagree with you on that. I would deny that, sir, because the decision is for cardiothoracic surgery to make. It is not my decision.
So, well, the order we looked at, it's Exhibit 1, and we can pull it up again if you like. this is your order, right? Right
Yes.
here, you see that?
Yes. Yes,
It's your order to discontinue the heparin, right?
right.
And there's no order starting a non-heparin anticoagulant, right?
Right.
All right, so that what happened is you stopped the heparin and you did not start a non-heparin anticoagulant.
I
Right?
would deny that. I would emphatically deny that statement. It is not my responsibility to start the argatroban. Cardiothoracic has the responsibility of starting the argatroban after the way the risks and benefits of the argatroban. I stopped the heparin because I was informed, I was told by cardiothoracic, which is documented in Delene's note, that the heparin needs to be stopped. And that's what I did. The next steps in terms of ordering the HIT panel and giving the argatroban lies solely on the shoulders of cardiothoracic surgery.
All right, and show me what note, show me Delene's note that you're talking about where she says, stop the heparin. Is that the one you just
Yes,
showed
sir.
me?
Yes, sir. Page 125. If you go into cardiac surgical assessment, postoperative day 6,
Hold on,
history
let
of
me pull
PA.
it. Let's pull it up. That's the last one you gave me, right? Yeah.
Yes, page 125. I think that's
So
the
this
last
is
one.
Exhibit
That,
8. Yeah.
yeah. If you look from the top where it
Yeah.
says cardiac, yeah. If you go down COD 6, history of CABD, acute blood loss, thrombocytopenia, heparin on hold, HIT sent. And
Wait,
that is heparin on hold and HIT sent. So if you look down below acute blood loss anemia, hematocrit is 29 stable. If you look right underneath, if you scroll up a little bit, then scroll up.
Okay. Can you see
Thrombocytopenia.
this little, can you see that little cross?
Yes. Yeah. If you go up, you're going in the right direction. You were just there. Just scroll down a little bit.
Okay.
That's it. You got it.
Acute blood
Thrombocyte-
loss, anemia, beneath thrombocytopenia, 104K, 115K, and this, of course, platelet count, right?
Yes, sir.
Heparin on hold and HIT sent. Is that right?
Yes, sir. And if you scroll a little bit
And
further
this
down,
is,
sir.
hold on one second. And this is Delene Huff's note, right?
Yes, sir. And if you scroll a little further down, sir.
Okay, same page. Yes, ma'am.
Right. If you would take a minute to read her notes, sir.
Yeah, I've read every word of this thing. So which part are you talking about?
I was just probably going to refer you to the fact that Dr. Myung talked to the patient's wife in private, and Dr. told her the thorough need to check the HIT and check the platelets. And so they were fully aware of what was going on.
But check the HIT. I mean, go ahead. Yep.
So that was my point, that cardiothoracic surgery was fully aware of the platelets going on. Dr. Myung had spoken to the patient's wife, and it was their responsibility at that time. If they felt that the need was there to start the argatroban, Dr. Myung could have asked Delene to do that, and Delene could have started it.
So, and of course, before November 2018, you were aware of argatroban and starting a non-heparin anticoagulant when you stopped heparin, right?
Right. For general medical patients,
right. And there's no note where you discussed that with Dr. Myung, right?
the need for argatroban?
Yes.
No, that's not a note that I would carry, because that is a discussion that happens between Delene and Dr. Myung. And once they both have looked at the risks and benefits, either Delene will go or start it, or Dr. Myung will instruct it otherwise. That is entirely their decision.
Understand. So it's 2:25. You guys want to take a short break? How long would you like, Doctor? 5, 10 minutes, 15?
Jim, you got an estimate on how much longer you got?
I don't know, maybe an hour. We've got some more stuff to cover, but I'll just have to go through it to see what I may have hopefully have already covered, but I mean, we've still got some more to do. Sir?
Maybe a 5-minute restroom break, and then we'll let you look over your notes and get back after.
Okay, see you in 5.
All right.
I'm gonna jump off this. I need to make a quick phone call. We'll call back in.
Okay, so I'll wait to hear from you then. You feel like the safest thing to do for Billy Saunier in this case was to discontinue the heparin and not to start a non-heparin anticoagulant?
I don't think I can answer that question. That is a question that should be posed to the cardiothoracic surgery.
Well, that's what you did though, right?
I did that because cardiothoracic surgery felt that that was the thing to do. But I cannot comment on that because, again, it's a cardiothoracic patient and there are some risks involved in starting another. And we never thought that there was a high probability of, we never thought that he had HIT. We were still looking for other causes.
So you were the one that stopped the heparin and did not start a non-heparin anticoagulant. And as your testimony is, you don't know whether that was the safest thing to do for Billy Saunier?
My testimony today is under oath that I was instructed to stop the heparin, and the decision to start an argatroban weighed entirely on the shoulders of cardiothoracic surgery, as the patient had had CABG, and I was going to follow the instructions that were going to be provided to me by cardiothoracic surgery.
And those instructions, to to the extent they're documented, we've gone through that, right?
As best as we can.
Well, I mean, I asked you to show me everywhere that may appear, and you showed me what you told me was everywhere you thought that may appear, and it didn't appear.
There was a conversation as documented on the 24th that I was in close contact with cardiothoracic surgery.
Uh-huh.
On the 25th, as documented in Delene's note, the heparin was stopped. Dr. Myung clearly states in Delene's note, per Delene's note, that there was a low probability, and they were going to think about it and decide whether or not to start the argatroban. That is entirely cardiothoracic surgery. It is not my role in cardiothoracic surgical patients to decide about argatroban, as the risk of bleeding is very high in these patients.
All right, I've searched the record, and nowhere does argatroban appear in this record. You agree with that, right?
That's correct.
So your testimony that there's a note that says they were going to think about the argatroban and get back to you. That's not in there.
No, sir. My testimony here today on record under oath is that the decision to start or stop argatroban, heparin, anything is entirely up to cardiothoracic surgery. We did not document about the argatroban in the notes. You're absolutely correct about that. There's no documentation. And I think this is a question that needs to be posed to cardiothoracic surgery, what they felt in terms of his probability of having HIT was, because there were other causes of thrombocytopenia that the team was thinking about.
Right. So your testimony, you testified that you don't know whether what you did was the safest thing for your patient. Is that right?
No, sir. No, sir. I did not say that.
I think you did say that. You said that's a question for cardiothoracic surgery and not for you.
No, sir. I said that I stopped the heparin, and the decision to start the argatroban rests entirely on the shoulders of cardiothoracic surgery.
All right. You stopped the heparin, and we're waiting to hear from cardiothoracic surgery on whether to start the argatroban.
I would not start the argatroban. It would have been Delene who would have started the argatroban. I would have been just informed that we are starting the patient on argatroban, sir.
Mm-hmm. You provided us with a copy of your credentialing file. I'm going to make that exhibit. Are we on 9, Madam Court Reporter?
Yes, sir.
Thank you. Show you what has been. So this is a copy of your credentialing file. Is that right?
I'm seeing it for the first time, so I'm
Okay.
assuming.
Have you ever seen your credentialing file before?
I mean, I've seen my credentialing file when we go for re-credentialing, but this is the first time I'm seeing it here.
Okay. If, it looks like at page 62 of Exhibit 9, your credentialing file, you were covering 4 hospitals, is that right?
Yes, covering in terms of medical or administrative duties.
All right. And those 4 include WellStar Douglas, WellStar Balding, WellStar Cobb, and WellStar Kennestone, which is where Billy Saunier died, right?
Yes.
And what was your, I mean, for instance, that weekend, that was Thanksgiving, right? That Thursday?
Yes.
Billy Saunier died on that Sunday?
Yes.
And from that Wednesday, well, even that Tuesday to that Sunday, when you were caring for Billy Saunier, what other hospitals were you covering?
When I'm at Kennestone, I just stay at Kennestone.
Okay, so you were just there at that time.
Yes.
Do you remember seeing Dr. Mayang in the hospital between Thanksgiving and the Sunday that Billy Saunier died?
I saw Dr. Mayang on the 25th because I was on the unit, and Dr. Mayang actually went into the patient's room. The patient was in blue 737, and I was standing at the nurse's station, and Deline and we were waiting for Dr. Mayang to come out. So I did see Dr. Mayang go into the room, but I was not privy to the information. And when Dr. Mayang came out, he said he had spoken to the wife. So that would have been my only recollection for that weekend.
And that was the extent of your conversation with it. He'd spoken with the wife.
Right.
All right. Now, moving on to page 84. This page is blacked out. Do you see that? 84 and 85. Why are those pages blacked out?
I have no idea.
Why weren't we provided a privilege log for the blacked out pages as required by the Uniform Superior Court Rule and Uniform State Court Rule 5.5?
Is that, Jim, that's not to the witness, that's to me, I'm assuming.
Well, that's for the witness, but if you want to answer it, I'm happy to give an answer. Yep.
I don't know. She doesn't know what a privilege log is. I don't believe she can answer it. And Jim, Heather must have produced these documents, so I don't know, and I'll figure that out.
All right.
And I'll object to
Do you know why these pages are blacked out?
I'm sorry?
Do you know why these pages are blacked out?
No.
Okay. If we go on down to a couple more pages, 88, that one's blacked out too. Why is that one blacked out?
I have no idea.
89, any idea why that one's blacked out?
No.
Okay. Have your privileges ever been suspended or curtailed in any way?
No.
165. Looking at 166, 167, 168, 169. Why are those pages blacked out? 165 to 169.
I don't know.
And why wasn't a privilege log provided for those blacked out pages?
I have no idea. I really can't comment on that.
All right, and now I'm looking at your credentialing file, which I believe was marked as Exhibit 9, pages 172, 173, 174, 175, 176, 177, 178, 179, 180, 181, 182, 183, 184.
Alert from calendar, DM.
185, 186, 187, 188, 189, 190, 191, 192, 193, 194, 195, 196, 197, 198, 199, 200, 201, 202, 203. That's 31 pages. Why are those 31 pages blacked out?
I don't know.
Okay. And why weren't we provided a privilege log on those 31 pages?
I don't know. I don't think.
Are you going to get us that stuff, Mr. Wellington?
I'll get you an answer to why those pages are redacted and a privilege log if appropriate.
Okay. Well, I mean,
Assuming it's peer review material and it's not discoverable under a credentialing, or at least it's privileged. I'll get you a privilege log.
yeah. Well, any claim of privilege, whether it's peer review, is subject to USCR Rule 5.5. So, we're entitled to a privilege log, and if you don't mind.
I don't agree. Just
Sir?
for the record, Jim, I don't think that's necessarily correct. I mean, I think there's law that you're not entitled to know that a peer review occurred. So,
That's a totally different issue. I'm still entitled to a
I'm sorry,
privilege
I was
log
still in the
pursuant to
process
the
of talking.
Uniform
Jim, I
Superior
don't
Court Rule.
so please don't.
What's
Okay.
that?
I said, please don't interrupt me when we're in the process of talking. I
Well,
don't think you are
did you
correct.
produce this document, or do you represent this
Still in the
witness?
I don't understand why you're talking over me.
Well, first of all, I don't, she can only
Again,
have one
I'm not
person defend the
talking-
deposition.
James,
Second of
I am
all,
not-
you didn't produce a
this is-
document. And third,
This is-
you don't
I'm
have
not-
any idea what's
No,
been
I'm not gonna
removed or
just
not
talk
removed.
over me.
So I'm not really sure, what your point is. If you're suggesting that there's a rule that says USCR 5.5 doesn't apply to a credentialing file, that is utterly ridiculous. Cite from any
Oh, you are-
case, any
No, it's peer review.
statute, any law review article, cite it.
I'll provide you the case law, James.
Sir?
I will be happy to provide you the case law. It's not my
Okay.
production. This is not my fight, but I believe you're misrepresenting the law.
No, you're the one that volunteered some information, and if you volunteer what is, according to you, purportedly the law, I'd like a cite to it.
I will be more than happy to send it to you. That you are not allowed under Georgia law to know if peer review occurred.
Yeah, I get that. I'm talking about something entirely different. My guess is you can see the chasm between what you're saying and what I'm talking about. If you can't, that too is not my issue. So you don't have a cite for me?
Not sitting with me right now, James? No, I don't.
Okay.
Hey, Jim, you waiting on us?
No, I'm pulling up a document.
Oh, I'm sorry.
That's all right. Showing you what's been previously marked as Exhibit 2 to your deposition, which is a stamped file copy. I'm sorry, Exhibit 3, your deposition, which is a stamp file copy of the medical records, which is 652 pages. This is page 27 of 652. Do you see where it reads here? No heparin due to low platelets.
Who's noted that? Delene, huh? Yeah.
Yeah.
Where's thrombocytopenia, heparin on hold hit was sent on the 25th.
Now hold on. Let me go up a couple pages just to get the start of this.
Yeah, that's fine.
You see, this is Sonia Camphor. That's you, right?
Yeah. Yeah.
And it says no heparin due to low platelets, right?
Yeah.
That's your note.
Yeah.
And
On the
that's-
25th.
Yes, ma'am. And that's, the heparin was withheld and stopped because of the low platelet count. Right?
Right.
And then if we go on to page 27 of 652, same exhibit, the medical records. Reads, heparin on hold. And HIT sent. By HIT, that's heparin-induced thrombocytopenia panel, right?
Right. That's Delene's note.
Right. And do you see where it reads rash on chest and thighs appears to be from Ioban, from the OR?
Yes, sir. So that is Delene's note, and that is, I believe, a sort of a bandage that's applied on the thighs after the surgery. And that is something either Dr. Myung or Delene can comment on it. And they're pretty much familiar with this. And that's why Delene sort of puts down a cause for it, but I cannot comment on it.
You agree that a rash can be a sign or symptom of heparin-induced thrombocytopenia?
No.
Okay. What's that?
I'm mumbling.
All right. And left hip osteonecrosis, do you see that?
Osteonecrosis, yes.
Let's see.
That's old age
Yeah.
in the left hip.
Well, there's no stopping that yet, is there?
Yes.
52, page 52 of 652, same medical record exhibit. 23. DVT prophylaxis, this is your note, heparin, is that right?
Yes, that's on the
This is on the
23rd.
23rd. Yes, ma'am. Go ahead.
The platelets had gone up to 156, sir.
Right.
By the time the patient came up from ICU. And so it had actually gone up rather than going down. So there was no concern at that point to think the possibility of HIT. And that's why to continue with the heparin.
So well, let's talk for a moment about that. You're saying that because, and I believe you're talking about on between the 21st and the 22nd, it went up, right? from 138 to 153,
Yeah,
back down to 141. So it went up once out of 1, 2, 3, 4, 5, 6, 7, 8.
His computer.
9, 10 readings. It went up on 1 out of the 10 readings. That was the
right.
6th
So-
reading, and that to you, hold on, let me finish my question, please. And that to you indicates that Billy Saunier could not be suffering from heparin-induced thrombocytopenia?
No, sir. My testimony today here is the following, that on the 19th, his platelets were 136. He was still in the ICU. On the 20th, he's still in the ICU. The platelets are 120. On the 21st, he actually shot 138. On the 22nd, when he actually comes to the floor, it's 153. On the 23rd, it's 141. It's still not a significant drop for us. And then when it drops from 141 to 115, that is when the team is saying, hey, the platelets have dropped. We do expect thrombocytopenia in our cabbage patients to be actually low after surgery for at least 5 days.
Your point is what?
I'm answering the question, sir.
That was an answer to what question?
The answer to your question, the question was there was only one drop in those 9 or 10 readings.
10.
As I walk you through the platelet drop, I am telling you that post-operatively, and Dr. Myung and Deline can answer this question far more eloquently than I can, it is not uncommon for our patients to have thrombocytopenia after surgery for 5 days. And so as you see, the trend wasn't significantly continuously going down. It actually goes up and down slightly till the 24th and the 25th, where we see a consistent drop, sir.
Is it also typical for a patient to have heparin-induced thrombocytopenia antibodies of 3.501?
I won't be able to comment on that, sir. I would defer that to some experts who have expertise in hematology oncology.
To your knowledge, have you ever had a patient that had heparin-induced thrombocytopenia antibody of 3.501?
I cannot recall, sir.
Okay. And you understand that normal is 0.0002 to 0.399, not 3.501. You understand?
Answer.
You're aware of that, right?
My answer.
That, if that's what the range is, that seems to be the correct response.
Page 64, I think we've covered this. So, Page 156 of 652. See where it reads fully heparinized? You know what that means? Fully heparinized?
Sir, this is in context to the CABG surgery. This is a procedure note by Dr. Mayang, and he will be the only expert person to comment on what he means when he writes that down, sir.
All right. Have you ever used the phrase fully heparinized?
No, sir, I don't use the phrase because I don't perform surgery.
Have you ever heard of that phrase?
I have heard it in context to the cardiothoracic surgery patients, such as CABGs, mitral valves, aortic valves.
And what does it mean to you?
It would mean that the patient was fully heparinized. The technical aspect of it, honestly, has to be explained by Dr. Mayang.
.263 of 652. This is where the heparin was discontinued. You don't have anything to share with me you haven't already shared regarding that order, do you?
No, sir.
274. The HIT antibody was present. Do you see that?
Yes.
And this is a result. It's collected on 11/25, and this result wasn't available until 11/27. Is that right?
Yes. Yes.
So that would have been the day after Billy Saunier died. Is that right?
Yes, because it's sent out to Wendy Hill, and I wouldn't be able to comment on how often they do it and when was the lab collected or anything. And it usually I think it usually takes some time for it to come back.
All right. And because it takes some time for it to come back, that's why you've got to treat the patient when you suspect HIT is suffering from HIT, because if you wait for the result to come back, it's too late. The patient can be dead, right?
So it's my testimony under oath today that we were not strongly thinking the possibility of HIT, as the likelihood was low, even as documented in Delene's note that Dr. Mayang said that there is a low probability of HIT. That is my testimony today, sir.
Well, but we looked at the HIT panel and we can look at it again. It's 3.501, and that's for blood drawn on the 25th, the same day you stopped the heparin. And the result is 3.501, which shows he was clearly suffering from heparin-induced thrombocytopenia on the 25th. True? Answer my question, then you can explain your answer.
Based on the test result in front of me, it shows that he has HIT. However, the decision to decide or the decision to make to start our Gatroban was to be decided upon by Dr. Mayang. And if Dr. Mayang felt that there was a low probability, that was one of the reasons he didn't want to start the Argatroban, I suspect, but I cannot answer for that for him. He needs to be able to answer this question.
Because you don't know.
No, because I don't make the decision regarding Argatroban, like I have stated before.
It is your order, though, stopping the heparin.
It is my order to stop the heparin after cardiothoracic directed me, and as documented in their note, to stop the heparin. I was never instructed to start, or there was never a notion even in Delene's note to start, because that note is co-signed by Dr. Mayang to start Argatroban. I can only act on what I have been directed to do, sir.
Only act. Well, only act on, well, you're a physician, right?
I'm a physician. I'm not a cardiothoracic surgeon. I have not performed the surgery, sir. It is a cardiothoracic patient, CABG, with grafts, and there are implications of being on anticoagulation and not being on anticoagulation that I cannot answer.
So this is 6 days after the surgery, after the cardiothoracic surgery we were talking about, the 25th. Surgery was on the 19th.
Right, CABG.
Right, and you're the hospitalist charged with his care because the surgeries happened a week ago, right?
I'm charged with his care in conjunction with cardiothoracic surgery, who makes all the decisions from a surgical standpoint and from an anticoagulation standpoint. They make all the decisions, sir.
So 4. At 275, this is the order for the HIT panel, right? You see that all right? Can you make that bigger?
Yeah, 11/25, 11/20 collected on 11/20. Yes.
Yes, ma'am. Well, at 11/20 on the 25th of November, right?
Mm-hmm.
And that reads heparin-induced platelet antibody electronically signed by Sonia Camphor. That's you, right?
Right.
Status discontinued. This is not talking about that's talking about the heparin where it reads discontinued on the right.
No, sir. It doesn't refer to the heparin. It refers to the HIT antibody.
Got it. That's the HIT order, right? The HIT panel order.
Right.
Got it.
Right.
Heparin part of surgery. That's all I have. You be safe, all right?
Thank you.
Thanks, Jim.
Thank
No
you, Paul. Thank you too, Paul.
Thank you. I have no question.
Doctor, I have one question. Clarification. Were you saying cabbage? Were you referring, is that how it sounds, cabbage?
Well, no, it's CABG, coronary artery bypass.
Thank you.
Yeah.
It's all caps.
It's all capital.
Got it.
To make it coronary artery bypass grafting, CABG.
Thank
Right.
you.
All right, be safe.
Thank you.
Spot.
Bye, everyone. Thank you.
All
Bye-bye.
right.
Thank you.
Bye, everybody. I'm signing off.